Chapter 8, Blood Collection Equipment for Venipuncture and Capillary Specimens. In this chapter, we're going to cover the equipment needed for venipuncture and capillary specimen collection, as well as the test tubes we utilize in phlebotomy. Collection equipment is used for venipuncture, blood collection from a vein, skin puncture, blood collection from a finger and or a infant heel, and then arterial puncture. Blood collection equipment, venipuncture equipment includes vacuum tubes, evacuated tubes and safety needle collection devices, tourniquets, supplies to cleanse a puncture site, labeling supplies, gloves, and a special tray to transport blood specimens. The vacuum evacuated tube system requires an evacuated tube, a double-pointed needle, and a special safety plastic holder adapter that covers the needle after blood collection. One end of the double-pointed needle enters the vein, the other end pierces the top of the tube, and the vacuum aspirates the blood. I'm going to zoom in on this picture here. We have the needle that will go inside the patient, the safety sheath, which covers the needle after we are done using it, the tube holder, which allows us to engage our test tube. These little flared pieces are called the flange, and then we have the actual test tube itself. Two criteria is used to describe the maximum tube volume: external tube diameter and length. They come in various sizes and volumes. Maximum amount of specimen to be drawn in the vacuum tube. Each test tube has a pre-measured vacuum that's based on the volume of the tube. Please see table 8/1 and 8/2 in your textbook. Each vacuum tube is color-coded according to the additive or anticoagulant present. They use serum, plasma, or whole blood for various analysis. Many coagulation factors involved in blood clotting. Coagulation is prevented by the addition of different types of anticoagulants or additives. For example, a plasma tube has an anticoagulant that would prevent clotting, where a serum tube has a clot activator in it, which allows the test tube to clot. Anticoagulants often contain preservatives that can extend the metabolism and lifespan of the red blood cells after the blood collection. So, for example, our EDTA lavender tube without that anticoagulant present would only be good for testing for 24 hours. However, with that anticoagulant, it preserves the red blood cells and allows us to do testing on the tube for up to 72 hours. We're going to start the order of draw. So the yellow top tube and vacuum culture vials or blood culture bottles are first in our order of draw, or our sterile procedures. They contain sodium polyethylene sulfonate, SPS. They can also, they're used for blood culture specimen collection in microbiology. They're collected in an aerobic or anaerobic blood culture bottle, as seen here, with a special procedure for cleaning. Tubes containing ACD additive are used for specialty blood banking, such as paternity tests. We will review in Chapter 15 the collection procedure for blood cultures. The light blue top tube containing the additive or anticoagulant sodium citrate. Many coagulation procedures such as PT and APPTT, which are blood tests, are performed on blood collected in light blue top vacuum tube. The tube might come with a pre-measured label that lets us know the fill volume for that tube. This particular tube is really crucial that we fill full, as it needs a 9:1 blood to additive ratio for adequate test results. The light blue top tube, some important information, is if the blue top tube is underfilled, coagulation results will be inaccurate. What happens is the anticoagulant is in excess and dilutes the blood specimen, leading to falsely prolonged results. So therefore, causing the healthcare provider to decrease by mistake the blood thinner dose, causing the patient to develop or a stroke. So what happens is that it looks like the patient takes longer to clot than they actually did. If the light blue top is overfilled, the results would be erroneously shortened, which basically means that the patient will clot faster, which might cause the doctor to decide then to increase the blood thinner medication, which could cause the patient to bleed out. Due to the importance of the correct amount of blood, these tubes can be obtained with fill lines. It is essential that these tubes are always full. Next, we have the serum separator tube, molten top, speckle top, and gold top tubes. These tubes contain a polymer barrier at the bottom of the tube. During centrifugation, the polymer barrier forms a barrier separating the serum from the fibrin in the cells. They also are spray coated with a clot activator on the inside. This accelerates the clotting process. The SST Gold red top tiger tubes take 30 to 60 minutes to clot before it can go into the centrifuge. Red top serum tubes. Red top tubes are tubes without anticoagulant or polymer barrier for the collection of a serum sample. These tubes allow for blood to clot and takes at least 30 minutes for fibrin clot to form. They, like I stated before, will either have a polymer barrier at the bottom or not, and they may have no additive in these tubes, or they might have a clot activator. The non-additive red tops can be used for a waste tube. Clear top tubes, white top tubes, and red light gray tubes, tubes with tops of clear white, red gray plastic, are used as discard or secondary specimen tubes. These tubes do not contain additive, and they're usually used as our discard tube in order to get air out of a butterfly line, or used as a discard prior to collecting another tube. The green top tubes and plasma separator tubes. Your book doesn't separate these tubes out. I do. So our light mint top tube contains lithium heparin. Our dark green tube contains ammonium heparin or sodium heparin. They're used in various laboratory analysis requiring plasma or whole blood. The green top vacuum tube should not be used for collection for blood smears on a microscope slide. The lithium heparin tube has a PST plasma separator gel barrier down at the bottom, where the dark green does not. The PST tube is utilized in the lab for stat testing when we need a test result in less than an hour. The BD Vacutainer Barricore tubes, these are new. They use a mechanical separator that reduces the centrifuge time from 10 minutes to 3 minutes and reduces cellular contamination by 50 to 65% compared to other current plasma gel tubes. They have a mechanical separator used to absorb hydrophobic drugs and for therapeutic drug testing. So basically the blood is added and then the mechanical separator drops to the bottom, therefore decreasing the centrifuge time. Next is going to be our purple lavender top tube. These tubes contain, EDTA. They're used for hematological procedures, molecular diagnostic testing, immunology, hemoglobin A1C, which is a 3-month window of glucose levels, and blood banking procedures. Please review box 8.2 under filling the purple top tube, as this is essential. This tube can also be utilized for a complete blood count, which would tell us the patient's white blood cell, red blood cell, platelets, hemoglobin, and platelet levels. The pink top tube also contains what's called K2 EDTA. It's used for blood bank collection and for viral collection. The one thing to make note of is this tube cannot share with other departments in the lab. So if you get a test that requires a pink top tube, know that it is one test for one tube. The gray top tubes usually contain potassium oxalate and sodium fluoride. They can also come present with sodium 2 EDTA and sodium fluoride or only sodium fluoride. They're used for glycolic inhibition tests because they have an anti-glycolic agent and glycolic inhibitor that prevents the glucose from breaking down. This is the gray top tube and is generally drawn last in order of draw, which we will cover later. Please be aware that the two most common additives or anticoagulants present in this tube is the potassium oxalate and sodium fluoride. Next, we have our royal blue and tan top tubes. Both these tubes contain K2 EDTA. The royal blue top tube is used to collect samples for nutritional studies and toxicology, or trace element testing, such as zinc. The tan top tube is used for lead testing and contains EDTA as well. If we were to do a lab testing, it also comes along with a questionnaire that we will have to ask the patient to submit with that testing as well. Just an FYI, the royal blue tap tube also comes as a serum tube as well, so we need to be really crucial about reading the label to make sure we have the correct anticoagulant present. Molecular diagnostic tubes, so special sterile vacuum tubes for molecular diagnostic studies, available containing different additives, so they could have sodium citrate, sodium heparin, EDTA, and required for different testing procedures. Manufacturers have different color tops. This is just a tube organizer that would allow the phlebotomist to manage their test tubes during the collection process. The safety syringe, as shown here, is used for patients whose veins are too fragile for blood collection with a vacuum tube. The safety butterfly needle, as shown here, blood collection sets are a preferred method. The syringes are hazardous and pose an increased risk of accidental needle stick. We will show you how to collect via butterfly syringe in class. This system shown here, you have to be specially trained to use because it is very easy to accidentally stick yourself, and it requires a lot of stability of that needle. This is a female transfer device. This would allow us to transfer from a syringe to a test tube. Safety needles and holders, gauge and length of the needles. So the gauge number indicates the diameter of the needle. The smaller the gauge number, the larger the needle diameter and the higher the flow rate. So larger 18 gauge needles are used for collecting donor units of blood. So if you've ever went in to donate your blood to Life Source, to Blood Center, they use 18 gauge needles. For phlebotomy, we will utilize 21, 22, 23, and 25 gauge needles. We will never be using the 18 gauge. These needles are used for collecting specimens for a laboratory. 21 gauge, being green, is going to be our largest needle. 22 gauge is a black cap needle. 23 is a light colored blue, which is a butterfly needle, and 25 is a royal blue pediatric needle. And as you see, the smaller the number, as shown here, the larger the diameter is shown in this image. So again, smaller needles, so 21, 22 gauge are used for phlebotomy. The Eclipse Safety Shield blood needle is attached to a holder. When we dispose of this, we'll dispose it all as one unit. This is just another blood collection system. It has an S-shape enclosed multi-sample blood collection system, collects blood using either the aspiration or vacuum principle of collection. Each needle has an integrated holder that does not require assembly before use and cannot be disassembled. We're going to check the tip of each needle for damage. Multi-sample needles are used when a vacuum collection tubes in the holder to allow for multi-tube changes without blood leakage within the plastic holder. So the bevel that we will be checking, I'm going to go back to this slide here, is this hollow portion of the needle. We want to make sure that isn't prior to sticking our patient. Multi-sample needle means we could draw 2 tubes, we could draw 20 tubes, but it prevents leakage. So we can use one needle for all the test tubes we need for our patient. The butterfly needle blood collection set, also referred to as the blood collection set or safety wean infusion set, was commonly used for IVs, but we can utilize this system when drawing fragile veins, small veins, pediatric patients, and also hands. So we have a couple different types of butterfly needles. Most common would be the 21 gauge, which is shown here with the green wings, the 23 gauge with the light blue wings, and then there's also the 25 gauge, which would have royal blue wings. And they range in length from 1/2 to 3/4 inch long. These needles each have a shield that automatically covers the device. There's a push button system here or a safety pull sheath, which is what we utilize in class. Needle and other sharps disposal must be discarded in a rigid, leak-proof plastic container. Each unit is usually orange or red and disposable as biohazard waste. There's different types of tourniquets. There's the pliable strap, the Velcro strap as shown here, blood pressure cuff, or the seatbelt design. Key to a successful venipuncture is the use of a tourniquet. It provides a barrier to slow down venous flow, but we don't want it so tight to cut off arterial flow. Non-latex disposable tourniquets are now available. These are stretchy, so it allows us to stretch to provide adequate tightness to visualize a vein. If the tourniquet used in the healthcare facilities are not disposable, they must be wiped frequently with 70% isopropyl alcohol and disinfectant with chlorine bleach solution of 1 to 10 if contaminated with blood or bodily fluids. The venoscope, which we will utilize and show you in class, is a method to detect a vein for blood collection, provides a non-invasive procedure to visualize the veins. It illuminates the veins. The AccuVein viewing system is an non-invasive portable handheld lightweight tool that provides a quick location of the veins. It doesn't give you depth, size, that you still have to physically touch your patient's arm to determine, but it gives you a visualization if you're having a hard time finding a vein. Gloves for blood collection. We use gloves during collection of blood from a patient. Do not use gloves with talcum powder because it could cause a falsely increased calcium level in a patient. And change gloves between patients' blood collection. Do not wash, disinfect, or reuse gloves ever. We will put gloves on in front of our patient and we will take them off in front of our patient so they know they're clean and disposed of properly. Antiseptics, sterile gauze pads, and bandages. These items are needed for blood collection by either venipuncture or microcollection. We use 70% isopropyl alcohol prep. We could use iodine, chlorhexidine for blood cultures are essential for blood collection. We also want to make sure the patient doesn't have any allergies to any of these prior to use. Microtainer equipment used for skin puncture blood collection techniques and used on infants because venipuncture is excessively hazardous. For infants, CLSI recommends a penetration depth of less than 2.0 millimeters on the heel stick to avoid penetrating the bone. These different color coding are different depths. So we could go all the way up to a 3. We can go all the way down to a 1. These are called the quick heel lancets and utilized for heel sticks on infants. These skin puncture devices here are used for finger sticks. Microtainers, plastic microhematocrit capillary tubes. They dispose narrow bore pipettes used for packed cell volume. They have color bands. Red band indicates heparin-coated tube. Blue band indicates no anticoagulant. These are very similar to our test tubes. They'll have the same additive or anticoagulant. These amber color tubes are utilized for tests that need to be protected from light. In Chapter 11, we will go over the order of draw for microtainer tubes, but they are just a smaller volume of what our original test tubes were for capillary collection. There's other versions of the microtainer tube. Again, the color coding according to established protocol for blood collection vacuum tubes, and they could come with a pipette as well for collection. Blood draw chair, there's different options. There's the recliner chair type. There's chairs with adjustable armrests, leg extensions, neck pillows or supports, scale mounts, storage cabinets, hydraulic lifts, and foot covers. This is a bariatric chair which would allow a parent and a child to sit together. If we suspect our patient has any history of fainting, we will want to place them in a recliner chair. We do need to have an armrest present because that would, if the patient were to faint, prevent the patient from falling into us. They should have armrests that lock in place so the patient cannot fall from the chair if he or she becomes faint. Should have an armrest that adjusts in an up and down position to achieve best venipuncture position for each patient. Maximum safety and comfort. This is the recliner chair. It allows the patient to sit farther back into the chair, and if we need to recline them back if they were to faint, that is an option as well. Specimen collection trays, they're taken on blood collection rounds, made of plastic, preferably latex-free, that can be sterilized. It includes all the necessary collection equipment. It is really essential that we keep our trays neat and organized. It allows us to have a faster procedure, and it also represents our lab. For home healthcare providers, they're carried in an enclosed container with a biohazard symbol on the outside, lockable to protect contents from tampering or accidental contamination, and has a tight seal to reduce bloodborne pathogens. If you were to travel with blood specimens, they do give you a biohazard locked container to store your specimens in along with your tray. Order of draw memory jogger, please review page 5-8 in your lab book. And I am going to so stop, light red, stay put, green light go. This is the mnemonic we use to remember our order of draw. So it's really essential to review this. S being sterile, light meaning light blue, red meaning red. Stay is our SST gold. P is our PST light green. Then we have our green. Lavender, which under this would also include our pink, royal blue, anything with EDTA. Tan, and then gray would be go. Order of draw. So again, the stop, light red, stay put, green light go, and I gave you a visual image of the tubes. We'll go ahead and zoom in on this image so you can see it up close a little bit better. So the stop is our sterile, which is blood cultures, SPS, and ACD. Our light, or our light blue, has sodium citrate. Red, which would have serum or none. SST gold, serum separator with or without the gel barrier. And our tiger top are in this category. The put is our PST with the gel barrier and lithium heparin. Our green, or dark green as I refer to it, is a sodium, could be sodium heparin or ammonium heparin. Lavender, pink, royal blue, tan, and whites all contain K2-EDTA. So the order of draw, if you were drawing just these tubes, wouldn't matter, but it does matter. It needs to come after the green, but before the gray. And go is gray, sodium fluoride, and potassium oxalate. In this image, each test tube has an adult version and a pediatric version. So we have the adult version of the light blue, which is a 2.7 volume. The peds is 1.8. The red top can come in a 6, a 4, or a 10. The SST gold could come in a peds, which is the 3.5 mLs, standard, which is 5 mLs, and 7.5, depending upon how many lab tests we need. The SPS is shown here in pale yellow. It is really, really essential that we determine what volume we need based on how many tests are ordered. So if we're going to have, let's say, 3 to 4 tests, we would opt to go to a bigger size tube. If our patients have frail veins or pediatric, we might use the pediatric tube because we would need smaller volume for that patient. Here again is, I'm going to show you the PS 4.5 ml. This is the dark greens. We have a 10 and a 4. The lavender comes in 4 different types. We can have a 3 ml, 4 ml, 4 ml with just a dark green top, just different toppers here, and a 10 ml. The pink comes in a 6. Pink can also come in a 10. Tan is always in a 3, and the royal blue is in a 6. And I'm going to fit this image here. Then if we scroll down, we have the white top, which is a 5 ml, and then we have the EDTA. And the EDTA, that's part of the white top. The gray top tube, and I'll have this image in the outside this PowerPoint, comes in a 3 ml, and then it comes in a 6 ml as well. And I apologize for the picture being cut off. Different volumes. So we utilize this depending upon how much blood we need to collect, also to how many tests we need. So this just gives you an overview of the various tests. It is really crucial throughout this semester that you know your order of draw. So knowing what tubes come first, second, third. We're not always going to have this strain of tubes though. So we might just have the light blue and the SST gold. Knowing the light blue comes before the SST gold is crucial. You will need to know the additives and anticoagulants inside the tubes. Also, there is a chart in your book to reference in your book that gives you more detail, that provides a breakdown of what the test tube is, what's the additive, what's the anticoagulant, what are some common tests, what department does it go to, and any special handling or special requirements you might need to know. I will go over that chart in a separate video, and that can be found under your laboratory procedures. This concludes Chapter 8's narrated PowerPoint. Please make sure to read the chapter and complete any questions at the end of the chapter to prepare for the chapter test at the end of the week.